74 pages that we remind them. For every word in here, it costs the American taxpayer $6.8 million. For every page, $1.2 billion. But I think one has to look a little further at this reform aspect. Does this bill really reform health care? And I think as you read through the bill, what you find is the word require, must, or shall 4,677 times. You find the word tax, fee, or revenue 899 times. You find the word agency, department, bureau, commission, or panel 470 times. But we're told that this bill does reform health care. We're told that it increases competition. It provides more choice. It stimulates innovation. Yet, we find the word choice 40 times. We find the word innovation 25 times. We find the word competition 13 times. I suspect that their intent is to fix what they haven't reformed by allowing the Secretary of Health and Human Services in 1,677 spots to define or determine what congressional intent was. Think about that. This bill basically turns over a lot of the decision-making to the current or future Secretaries of Health and Human Services to decide what we meant in the Congress. Well, my good friend from Tennessee raised a lot of things on Medicaid, and I want to talk about Medicaid, but I also want to mention that, once again, we're paying for this by cutting $464 billion from our nation's seniors. That is a trust fund. They've paid in premiums, just like the Class Act. It shouldn't be a surprise to us that they're going to steal money out of the Class Act that hadn't even been created yet, because in the bill it's taken $464 billion from seniors that have paid into it for a lifetime. And within that group of seniors, 11 million seniors are going to have their benefits cut because they chose Medicare Advantage as their preferred insurance product. It's not a question whether they can keep what they've got. They can't keep it because their benefits are going to be cut, and that affects America's low-income seniors the most. As a matter of fact, in this bill, we fixed doctor payments for 1 year. So in 2011, doctors' reimbursements are going to be cut 23%. I see Dr. Barrasso on the floor. So we know more doctors are going to stop covering Medicare beneficiaries. The pool's going to get smaller. We're going to affect every senior's health.
So in essence, Medicare will become more like Medicaid because of the way this bill. Less physicians will be covering Medicare recipients because this bill, instead of using the $464 billion to make sure physicians are paid, it's to leverage a new entitlement. So my assumption is that this program, unless something else happens, will become more like Medicaid. Medicare will become like Medicaid.
The senator from Tennessee is 100% correct. Today, 40% of our nation's seniors are under Medicaid, or 40% of our nation's physicians under Medicaid will not see patients, because the reimbursements are so low, and that's what we're creating in Medicare now for 30+ million seniors by cutting Medicare. But we were supposed to talk about Medicaid. Reform in health care means that you have to eliminate cost shifting. As Dr. Barrasso knows, cost shifting is when somebody goes in for a service, gets health care delivered, and doesn't pay. Or somebody goes in that's underinsured, gets delivered a service, and their reimbursement doesn't sufficiently meet the needs of the cost of that service delivered. But it doesn't stop there. Medicaid reimburses at 72 cents of every dollar of service provided. So today, for every Medicaid beneficiary in America, every time they receive a service from a doctor, a hospital, wherever, 28 cents is shifted over to the private side, to those that pay out of pocket, to those who have private insurance. If you're reforming health care, you can't reform health care without eliminating cost shift. Yet, in this plan, we increase the rolls of Medicaid by 15 million individuals. In essence, what that means is that we're going to have cost shift on steroids now. We're going to have more cost shift than we had before, which means a higher inflation rate on private health care, that we pay out of pocket, or that employers, in fact, provide for their employees. As a matter of fact, incorporated in this bill is a disincentive for small business success. I'm not sure that everybody's read to that point in the bill yet, for a company that today can't afford, because of their competition, to offer health care, the day they hire the 51st employee, the federal government will send them a tax bill of $38,250. At a time where we have 10.2% unemployment, 11% in North Carolina, small business is going to be the engine of job creation in this country. And we're saying, as soon as you're successful enough that you hire the 51st person, if you don't offer the health care we tell you you have to offer, we're going to send you a tax bill of $38,250. And unfortunately, it doesn't stop there. For the Medicaid beneficiaries, for the Medicare beneficiaries, for everybody in America, where we've said drugs are too high, devices are expensive, innovation costs money. What are we going to do? We're going to tax drug companies. We're going to tax medical device companies. We're going to actually raise the cost of our ability to detect disease earlier, where our options are greater, and hopefully through having those options earlier, in fact, we're going to be able to treat a disease or cure it much cheaper. And I might add, it is somewhat ironic that we're going to tax vaccines at a time that the industry is struggling to try to meet the needs for H1N1 vaccines across this country. This bill puts a new tax on the vaccine industry that we have tried to revitalize in America. Let me suggest to my colleagues, this is not a health care bill. This is a layaway plan. In fact, what we've been presented is a plan where they're asking Americans to pay in for a number of years, 4 to be exact, before they get their product. We're going to pay in taxes. We're going to pay in Medicare shift. We're going to begin to increase the rolls in Medicaid, to wait 4 years down the road before we get the product, before we get any benefit out of it. And you know what we're going to find 4 years down the road is the cost changed. You see, it's sold as a $849 billion plan today. $849 billion health reform package. Well, that's not what it is. If you look at it truly over 10 years, it's a $1.2 trillion plan. And if you wait and start until the benefits are paid and look at it for a real 10 years of revenue and benefits, it's a $2.5 trillion plan. We can't even be honest enough with the American people that we tell them exactly what it's going to cost. But you would expect that out of a layaway plan. And in fact, that's what we've got in front of us. Let me suggest to my colleagues that if you reform health care, you can have coverage expansion without additional taxpayer investment. You can't take the things that are broken in our system and actually increase their use, like Medicaid, and expect at the end of the day you're going to be able to save money, provide a better level of care, more importantly, that you're going to have a population that gets the benefits that everybody else does: a medical home, preventative care, chronic disease management. It doesn't happen in Medicaid today. It won't happen when you increase the rolls of Medicaid. It will only happen when you reform health care, and this bill does not do it. I thank my colleague from Tennessee.
Carolina, he's worked extensively on this issue. I think we have a couple senators that have